On July 19th, the Centers for Medicare and Medicaid Services issued a new proposed rule on price transparency, health equity, and access to emergency care in rural areas. The rule was a standard annual rule to update Medicare payment rates for certain hospital and surgical center services. But this year's rule also included some proposals that align with several of the Biden administration's goals, including addressing the health equity gap, fighting COVID, encouraging transparency in health systems, and much more. The U.S. Department of Health and Human Services says that this proposed rule also helps to act on President Biden's more recent competition executive order. It was on July 9th that President Joe Biden signed an executive order to promote competition in the American economy. The executive order established a whole of government effort to promote competition, acknowledging that there were several anti-competitive practices across industries that were driving prices up. And he specifically acknowledged the healthcare industry as one of the problems. The Centers for Medicare and Medicaid Services says that by issuing this specific proposed rule, they are further strengthening their efforts to increase price transparency and hold hospitals accountable, while also encouraging consumers have the information they need to make the decisions they need to make about their own healthcare and coverage. So a couple of the provisions. First, on price transparency. We know that hospital price transparency was mandated back in January of 2021. Hospitals are required to make clear, accessible pricing information on hospital charges for items and services available online for consumers. But the Centers for Medicare and Medicaid Services say they take very seriously the concerns that this hasn't been happening. So in this proposed rule, they are making stiffer penalties for hospitals that are not being transparent. The penalty could be up to $2 million a year for certain hospitals. They also talked about health equity. Centers for Medicare and Medicaid Services is seeking input in this proposed rule on ways to make reporting of health disparities based on social risk factors, race, and ethnicity more comprehensive and more actionable. Centers for Medicare and Medicaid Services wants comments on data collection, on analysis, and on reporting measures so that they can get demographic data points that they need to be able to make improvements. They said data points could be collected on race, on Medicare and Medicaid dual eligibility status, on disability status, on LGBTQ, and other social economic status points. What's next? Well, this proposed rule was published in the Federal Register on July 23rd. There is a 60-day public comment period. That takes us into the middle of September. The final rule with comment period will be issued in what is expected to be early November. In a statement, the U.S. Department of Health and Human Services Secretary Becerra says, as President Biden made clear in his executive order promoting competition, a key to price fairness is price transparency. And he continues, no medical entity should be able to throttle competition at the expense of patients. Concealing the costs of services and procedures will not be tolerated by this administration. Some strong words coming out of the agency head. Like we said, we only covered a couple pieces out of this new proposed rule. You can read the entirety of the proposed rule linked in the description below. The Centers for Medicare and Medicaid Services also gives us a fact sheet and a press release that you can review that goes through some more of the highlights. You can also read that executive order on competition. We link to that in the description below.